Hi, Professor Bogart. My name is Rachel Dare, and I'm a part of your Anatomy and Physiology lab group, lab section. And today I'll be talking to you about what I know about the skeleton. Now, my skeleton, his name is Paul, and I'll be demonstrating on him for you what bones I know of the skeleton. Now, the skeleton is broken up into two main parts, the axial and the appendicular skeleton. The axial skeleton is composed of the skull, the thoracic cavity, and the vertebral column, and the appendicular skeleton is composed of the pectoral and the pelvic cavity, and as well as the upper limbs and lower limbs, basically everything else. So I'm going to be starting with the skull. The skull is divided up into two parts. The cranium with the cranial bones, there are 8 of them, and then the facial bones from here to here, and there are 14 of them, so 22 in total. There are sutures that connect bones in the skull. They're only found in the skull, and there are 4 major ones. This is the coronal, and this is the sagittal here. Then we have the lambdoid here, and then we have the squamous here, although it's not terribly greatly shown on him. We have the 2 parietal bones, we have the frontal, we have the 2 temporal, and then we have the occipital bone, and then we have the sphenoid bone that goes through the skull and makes up the back of the eyes, or the orbits. And then we have the ethmoid bone, which is in the nasal cavity, the top part of this. Then we have the 14 facial bones. Most of them come in pairs. We have 2 maxilla bones. We have 2 lacrimal bones, which are in the inside for the tear ducts, 2 nasal bones, 2 zygomatic bones, the mandible, which goes down here, the vomer, which is the lower portion of that divide right there, and then we have 2 inner inferior nasal bones there, and then we have the 2 patellar bones, or palate bones on the top of separating the oral cavity from the nasal cavity. So those are the facial bones. A little bit of specific about the temporal bone that is right here. It has the zygomatic process that connects it articulates with the zygomatic bone up in front and creates your cheekbone. It also has the external acoustic meatus, allowing sound to come into your ear. It also connects inside with the hyoid bone. It actually doesn't connect to the bone. It has a ligament that attaches itself to it, because the hyoid bone helps with swallowing and with speech, but is the only bone in the body that is not directly articulated with another bone. So that's in there too. So that completes the skull. We move on to the thoracic cavity and the vertebral cavity. The vertebral column goes all the way from the skull to the pelvic cavity, and is broken up into the cervical. There are 7 cervical vertebra, 12 thoracic vertebra, 5 lumbar vertebra. Then we have the sacrum and the coccyx down there. And we have the vertebra are structured in such a way that they have a body, which is where all of these processes are attached to. They have an intervertebral disc that is indicative of a cerebral, cervical, thoracic, or lumbar vertebra. They all have intervertebral discs. They have a vertebral foramen or foramen, where the spinal cord is housed. They have intervertebral foramen those little holes, that are for nerves to pass through, and they have a number of processes. The spinous process is this, what sticks out at the end. There are transverse processes, and the spinous and transverse processes are what tendons and ligaments attach to for the bones and other structures that are bones and muscles that are around them. And they also have inferior and I guess it's here, yeah, inferior and superior articular processes that attach each vertebra to the one superior and the one inferior to it. I don't know if I said this already, but there are 7 cervical, 12 thoracic, 5 lumbar, 5 fused sacral, and 4 fused coccyx vertebra. So those are those. And so we'll take a little closer look at the cervical. They're labeled C1 through C7. C1 and C2 are a little more interesting. C1 is called the atlas. It doesn't have a body or a spinous process. It is composed. It basically has two superior articular facets where the occipital condyles of the occipital bone rest, allowing us to nod our heads. And then the 2 inferior articular facets are for articulation with C2, or the axis bone, the axis vertebra. So this vertebra has a body and a spinous process, but it also has a dens which protrudes upward through the atlas, and allows for the pivot motion of our head going side to side, or indicating no. So the cervical cervical vertebra are for head movement. The thoracic are connected to ribs, and T1, and they're labeled T1 through T12. T1 through 7 are because the ribs the ribs on T1 through T7 are called true ribs because they connect to the sternum. This is the sternum. And T8 through 12 are called false ribs because they don't directly attach to the sternum, or as in T11 and T12, they're called floating ribs. They don't attach to the sternum at all. Thoracic ribs have facets, demifacets, that attach the heads of the ribs to them. They attach to the ones, like I said before, they attach directly to the ribs, the thoracic vertebra that of their number, and also the one directly superior to it. So they attach to 2 of them. The sacrum is the lumbar. There are 5 of them, L1 through 5, and they have hatchet-shaped spinous processes, and they support a lot of weight, and so they're big and bulky and strong. The sacrum is the posterior part of the pelvis, the pelvic cavity thing, and the coccyx is the tailbone. That's all there is to it. Excuse me. Alright, so that is the axial skeleton. So now we're going to go on to the appendicular. Alright, so we have the pectoral girdle, with the clavicle and the scapula, right there. And then the glenoid cavity is where the humerus attaches or articulates, as a little ball and socket joint. And the trochlea are where the olecranon process and the coronoid process of the ulna attached to form the elbow, also with the radius, at the elbow to form the elbow joint. So this again is the humerus, and this right here is the ulna, and this is the radius, and there's the carpals. And then there's, alright, so the carpals, there are 8 of them. I'll say them in a minute. But then we have the metacarpals, which are labeled 1, 2, 3, 4, and 5. And then we have phalanges. We have the we have the proximal, middle, and distal phalanges. So now, I don't remember the carpals right now, so I'll tell them later if I have time. Alright, so we're doing now our, we have the pelvic cavity, we have the ilium, we have the pubis, and we have the, excuse me, and we have the ischium. Those fuse to form the pelvic region. And then the acetabulum is the place where the femur articulates. This is the femur, longest bone in your body. There's the patella, which is your kneecap, and we have the tibia, which is your shin bone, and the fibula, which basically reinforces or stabilizes your ankle. Your ankle is called the talus, and your heel is called the calcaneus. I'm not sure if I pronounced that correctly. So we have the bones in the foot. We have the medial, intermediate, and lateral cuneiform. We have the choroid, and then we have the it starts with an N, navicular bones. And then we have the phalange, well then we have the metacarpals, metatarsals. We have the 1, 2, 3, 4, 5, and then we have the phalanges, which are there's the proximal, middle, and distal phalanges. So that is the entirety of the skeleton, except for the carpals. The pollex is the thumb, but we also have the carpals, which are the scaphoid, scaphoid, lunate, trapezius. That's not it. And then I don't know that one. And then we have the trapezium, the trapezoid, the capitate, and the hallux. Those are the distal layer of them. So I think I covered everything. This is the skeleton, and yeah, I hope I did everything correctly. Have a great weekend.